Hey everyone, Anthony here from Physical Therapy and Balance in Physical Hazleton, here to talk to you guys about squatting. In this edition of Physical's exercise series, I'm going to talk to you about squatting, the history, what it's good for, and how it's done. So let's discuss the history of the squat. So squat is one of the most primitive movements that we have. We could do it as a baby, and we could do it throughout our whole life during all activities, and it's needed for all activities. But the first recorded history of the squat as an exercise was in 1919 between two German weightlifters. In 1921, a German by the name of Henry Steinborn brought the lift to America and started introducing it in lifting competitions. So let's talk about why we should do the squat and what it's for. So obviously the squat is a leg exercise that focuses on the quadriceps, the front of the thigh, the buttock, the glutes, the back, your erector spinae, which is the muscle in your lower back, and your abdominals. For those of you who are trying to get in shape and fit, this is going to help tone your legs and buttock. For your everyday person, it's going to help with your activities of daily living, being able to pick something up from the ground. And then if you're an athlete, it's going to help with strengthening and power for more explosive movements like a jump or sprint. They actually found that weakness in the glutes and lateral hip could actually lead to injury in the knees, ankles, and lower extremity. So squats can be very beneficial for any person of any age. So now you know what a squat is, let's learn how to do it properly. So let's break down the form of a squat. So when you squat, you want your feet to be about shoulder width, maybe a little bit greater than shoulder width apart, and slightly toed out. When you start to descend into the squat, you want to hinge at the hips, pushing them backwards, trying to place your weight through the middle of the foot, closer to the heels if you can, so you don't rise up on your toes. Once you get to the bottom of that squat, you may want to make sure your back is flat and straight. Weight is through the hips, and knees are not further displaced than your toes. As you're coming up, you want to push through your feet, pushing through the ground, extending at the knees and hips until fully upright. So common mistakes, mechanical problems that happen during a squat that could lead to injury that you want to really focus on as you're doing them is first what we call a valgus collapse at the knee, where that's when the knee caves inward. So you see this a lot, usually at the bottom of the squat when someone's trying to come back up, their knees will cave in, causing increased stress on the inside, of the knee, pushing the kneecaps out. It can lead to a lot of different problems at the knee joint. Another thing you want to avoid is too much forward flexion of the body. If your back's not straight and in good posture and it's too far bent forward, you can lead a lot of stress to the lumbar region, causing some problems there. Also, you want to make sure your ankles are stable. You don't want to be bending too far in, while you're squatting. That also lead to those knees coming in, and it can also lead to some stress at the ankles as well. Now that we talked about form and some common issues that people have with the squat, next question would probably be, how many should I do? And that's a question we get a lot here, and there's no right answer for each person. So if you're over the age of 60, a good rule of thumb is to look at a 30-second sit-to-stand test. This test shows how many squats or sit-to-stands you could do within 30 seconds, and it correlates your risk of falls. If you are greater than a certain number, your fall risk is generally low. If you are below a certain number, according to the graph, your fall risk is higher. So if you're in that high fall risk area, you want to really work on these squats and these sit-to-stands in order to decrease your chance of falls and increase your overall athletic performance, overall function. Now, if you are someone who's getting into weightlifting, there's actually a chart out there that's been studied that shows body weight in correlation to what your numbers should be. And it shows what you would be if you were a novice, a beginner, intermediate, advanced, or an expert elite lifter. So if you want to compare yourself to that, that's a great tool to use to see where you're at in that. My rule of thumb is if you could do 3 sets of 10 to start, just body weight, and you have good form, good mechanics, and it doesn't hurt at all, start adding a little bit of resistance. If you do those 3 sets of 10 and you feel real sore, fatigued, and you feel like your form was breaking down, then you want to drop off a little bit, either in sets or reps, and then kind of take it from there. So if you feel like you're not ready to do a full bodyweight squat just yet and you want some variations of it, I have a few for you. So the first one I'm going to show you guys is a wall squat. So that's with using the wall as a support system for your back. So your back will be against the wall, your feet will be out in front, and you're going to slowly descend using the wall as a kind of like a support system to help glide you down and then pushing back up. It'll allow your legs to work without having to worry about the stability of your upper body since it's going to be against the wall. Another variation would be a upper body assisted squat. So this would be using something like a TRX or a bar or banister, chair, table, whatever it is. By using your arms to hold on, again, you're taking out the component of balance in it, and you're just able to focus on the mechanics of the hips, knees, and ankles. A third variation would be something like a box squat or a chair squat. So this is using a target to kind of assist you with your cueing. So as you're going down, you're trying to aim for the box or the chair or object that you place down. This could be at any height depending on where you feel comfortable and where your strength levels are. And this will give you, like I said, that cue to know how far you're going and where you're going to. For those of you who find squatting with body weight to be easy at this point, there's a lot of ways we can make it harder. So the easiest way would be to add some weight. This could be with anything like a dumbbell, barbell, it could be a backpack filled with books, it could be water jugs, it could be anything to add a little bit of resistance, add a little weight to the squat. Another variation could be a single leg squat. So now we're adding in both balance, coordination, along with strength of one limb at a time. All right, guys, so now you know the history of the squat, how it's done and why it's done, and some variations on how to do it. So make sure you get to squatting, practice it, use it. It's a very valuable exercise that could help you in your everyday activities all the way to athletic abilities, whatever it is that you're trying to, get better at or move more pain-free. So if you have any questions and you feel like you might not be doing it right or something feels wrong, please feel free to give us a call or talk to your local physical therapist. We'd be glad to help you out. So remember, let's get physical and let's get squatting.